name is Emily, and I'm one of the dermatologists working at KK Women's and Children's Hospital. In our department, we see many children with skin problems, and this includes children with rare skin conditions. It's believed to be because their skin is as fragile as butterflies' wings. Walking longer distances, wearing new clothes with seams, or new shoes can lead to blisters on their skin after the friction. These blisters can be rather painful and they do take time to heal. Okay, so severe forms of EB may be associated with a shorter lifespan in these affected patients. However, for the milder forms of EB, these patients can go on to lead relatively normal lives. As long as they adapt to the situations, they try to minimize the triggers and the friction that can induce their blistering. I've seen them lead pretty normal lives to the best of their ability. Okay, so I think it depends on whether EB runs in the family. So if it's the first person in the family to have EB, and if especially it's a more severe form of EB, I think the diagnosis can come as much of a shock and surprise, because not only does the family have to cope with acknowledging the diagnosis, EB also comes with a lot of caregiving that's required. So that can be very difficult for them to accept. So that's why societies like ours, Rare Skin Condition Society, are an important network for these parents and their families to find support and to share tips with each other so that they can better cope with the condition. So on the other hand, if EB runs in the family, I've seen parents where mild forms of EB runs on one side of the family, and when their child is diagnosed with EB, they take it in their stride because they believe that it runs in the family. They've learned ways of how to cope with it through the years, and so they take it very well. I recall one of the families that I saw in the Epidermolysis Bullosa clinic in Toronto when I was doing my Paediatric Dermatology training several years ago. And there was this particular child. He was about 7 or 8 years old, and he had a more severe form of Epidermolysis Bullosa. And I could see that despite the fact that his skin was covered with sores and he had so many dressings which were painful to remove for us to inspect, and the fact that he was suffering, he could still have a very sunny disposition and a cheerful attitude. He would always be very grateful for the care that his parents as well as his nanny would give to him, and I think that inspired me because of his perseverance in adapting to normal life, his smiles through the pain, and it really made me realize and resonated with the phrase, every cloud is a silver lining. He was able to be optimistic through that suffering.